Hi, I'm Evans Omete, and this is my presentation on workplace violence in the ER. So imagine you're the triage nurse. Your patient is pacing, yelling, staring, and clenching his fist. He has been waiting and he's intoxicated, and his frustration is rising. What do you do first? What do you do next? So, why does this matter? Workplace violence is common in the emergency room and can have serious impact on nurses and the care they provide. In one emergency department study, 96% of nursing staff reported verbal abuse. 54% of nursing staff have reported physical assault, and 72% of all emergency department staff have experienced some form of workplace violence in the previous 6 months. Workplace violence is defined as incidents which staff are abused, threatened, or assaulted in situations related to their work. This matters because workplace violence affects not only staff safety, but also patient care, team morale, and staff retention. If workplace violence is this common, the next question is, how can ER nurses recognize risk early? This is where evidence-based screening tools are important. So, to answer my question from the beginning, what do you notice first and what do you do next? Here are three evidence-based tools ER nurses can use to recognize violence risk early. The first is STAMP, which stands for staring, tone and volume of voice, anxiety, mumbling, and pacing. I like this tool because it helps nurses quickly notice observable warning signs during triage or early patient contact. The second is the Bracet Violence Checklist, or the BVC. This tool is a little more structured and looks at confusion, irritability, boisterousness, verbal threats, physical threats, and attacks on objects. The third tool is the QOVPRAO, which is the Queensland Occupational Violence Patient Risk Assessment Tool. This is especially useful because was developed for the emergency department. It looks at three key areas: aggression history, behavior concerns, and clinical presentation concerns. This tool also can be used throughout the hospital as well. Together, these tools help move nurses from a gut feeling to a more objective assessment of risk. So, what should the ER nurses do next? Once risk is identified, the nurse needs to act early. First, recognize and name the behavior using the object language. Instead of saying the patient is dangerous, describe what you actually see, such as pacing, yelling, clenched fist, staring, or threatening language. Second, use calm de-escalation by speaking clearly, keeping your tone low, setting limits, and giving simple directions. Third, make the environment safer by creating space, reducing stimulation, and making sure staff have a safe exit path. Fourth, you need to call for help early, whether that is another nurse, charge nurse, security, or the provider. And finally, you want to document what happened and reassess the patient because behavior can change quickly. The goal is to prevent escalation, protect everyone in the room, and respond as early as possible. So, how do ER nurses advocate ethically and legally? ER nurses advocate ethically and legally by balancing patient rights with safety. Even when a patient is escalating, the nurse should still protect the patient's dignity and avoid judgmental labels. That means using objective, behavior-based language, such as the patient is pacing, yelling, they have clenched fists, that making threatening statements instead of calling the patient aggressive or difficult. Nurses also advocate by using least restrictive interventions first, such as calm communication, clear limits, reducing stimulation, and also offering choices when possible. Legally, though, nurses must follow hospital policy for security involvement, restraints, documentation, and incident reporting. Advocacy also means protecting the patient's rights while also protecting staff, coworkers, and other patients in the emergency department. Social justice and quality improvement. Social justice means responding to behavior without stereotyping the patient. The research that I've seen shows that workplace violence is not usually tied to mental health alone and is often linked to chemical health issues, which is why nurses need to objectively assess instead of assumptions. It also says that all violent incidents, harassments, and microaggressions should be reported. That improves quality because early screening and consistent reporting helps the ED respond sooner, prevent escalation, and create a safer environment for both staff and patients. In conclusion, workplace violence in the ER is not just part of the job. It is a serious safety issue that affects nurses, patients, teamwork, and the quality of care. It is important to recognize early warning signs as evidence using evidence-based tools like STAMP, BBC, and QOVPRAO, and responding before situations escalate. We also can advocate by protecting the patient's dignity and avoiding assumptions and using the least restrictive and safest interventions when possible. When we assess risk early and communicate clearly and report incidents consistently, we support social justice, improve safety, and strengthen quality of care for everyone in the emergency department. Thank you.